pediatric surgery. It sounds almost like an oxymoron, doesn't it? Like
Yeah.
operating on patients sometimes no bigger than like a loaf of bread. Wild. But then you dive into the actual advancements they're making in the field and whoa, my mind was blown.
It's amazing. And yeah, it's definitely not just about shrinking down adult procedures.
So what are we talking about here? What kinds of things do surgeons have to consider when they're dealing with, a patient the size of a grapefruit or something?
Well, I mean, everything changes, right? Like the actual instruments they use, how they approach anesthesia. Think about it. You've got a procedure to correct a congenital heart defect, and the patient is an infant. Their heart is like the size of a walnut.
Whoa.
And they have these special instruments, miniaturized, designed to work with those tiny structures. It's remarkable, really.
It's kind of terrifying, too, when you think about it. Like, the margin for error has got to be practically zero.
Absolutely. And on top of that, you've got this whole other layer of complexity.
Yeah.
Kids are, they're constantly growing. Their physiology is always changing. So surgeons have to take into account how a procedure might impact that child's development later on.
Right. You don't really have to factor that in with an adult patient in quite the same way.
Exactly. Which is why this whole field is so incredible. I mean, it really is about pushing the boundaries, not just to treat, but to actually heal, but a way that takes into account, that child's optimal growth and their well-being long-term.
Speaking of pushing boundaries, minimally invasive surgery, that's got to be huge, right? Especially for kids. Less pain, quicker recovery. I mean, as a parent, that's what you want.
For sure. But what's really exciting is how much technology is changing the game, making these procedures even less invasive. We're talking robotic-assisted systems with these teeny tiny instruments, cameras, surgeons operating through incisions smaller than a dime. It's crazy.
Yeah, that does sound kind of sci-fi, but it's not just about making a smaller cut, is it?
Right. I mean, think about it.
Okay.
Smaller incision means less trauma to the tissue, less pain, obviously, faster healing time, fewer complications, which for a kid, their body's developing so rapidly, it can make a huge difference in how they heal long term.
So tiny incision, huge impact. Potentially.
Exactly.
I read that some surgeons are using 3D endoscopy now during minimally invasive surgeries.
Oh, yeah. I mean, that's pretty amazing. Basically, the surgeon puts on these 3D glasses, right? And suddenly they're seeing inside the body with this incredible depth and clarity, almost like they're navigating a video game or something.
Yeah. So it's not just a flat image on a screen anymore. They've got this like three-dimensional view.
Exactly. And that allows for even greater precision, even better control during surgery. And that's critical, obviously, when you're operating on such delicate structures.
You don't really think about everything that goes on behind the scenes to make these surgeries so safe, until you start to really look into it.
Yeah, and it's not just the technology either. It's the surgeons themselves, right?
Wow.
I mean, these are people who've trained for years to use these tools with, incredible expertise. They're constantly honing their skills and, like I said, pushing those boundaries of what's possible.
It sounds like this is a field where you always have to be learning. Like there's always something new to discover. But with all this incredible technology, do you ever worry that surgeons might start to rely on it too much?
I mean, it's a valid concern, for sure. But at the end of the day, technology, it's just a tool. It can enhance a surgeon's capabilities, but it can't replace that human element. You know what I mean? The judgment, the years of experience, the intuition that comes from actually doing the work.
Right. There's no substitute for that human touch, especially, when you're dealing with families who are, let's face it, probably pretty stressed out.
Totally. And speaking of families, another area where technology is having a huge impact is pre-op and post-op care. Especially for families that don't live close to a specialized children's hospital.
Totally.
Yeah, imagine you've got a family, right? Living in a rural area, maybe hundreds of miles from the nearest children's hospital. Telemedicine is huge for them. They can consult with specialists, get follow-up care, even monitor their child's progress all remotely.
That's amazing. Bringing the expertise to the family no matter where they live. But what about some of the less obvious ways that telemedicine is being used in this field?
Well, one thing that comes to mind is this whole idea of telementoring. So you can have an experienced surgeon virtually guiding a colleague through a really complex procedure, in real time.
Wow, so it's like having a world-renowned expert right there in the OR with you, even if they're actually miles away.
Exactly. It's pretty amazing when you think about it.
Yeah.
And it really speaks to that collaborative spirit in this field,
Yeah, it's not about keeping all the knowledge to yourself. It's about sharing it and helping as many kids as possible. And speaking of collaboration, we've got to talk about prenatal surgery. That's another area where having a whole team of experts is crucial.
Absolutely.
I mean, operating on a fetus while it's still in the womb, It sounds like something out of science fiction. What kinds of conditions are we talking about here?
Well, things like spina bifida, congenital diaphragmatic hernia, even some heart defects can be addressed prenatally. The idea is to correct these issues early on, because if you wait until after the baby's born, it often means more complicated surgeries down the line, longer recovery times.
So it's about giving these tiny patients a healthier start and potentially avoiding more invasive procedures later on.
Exactly. And it's still a relatively new field, of course. There are definitely challenges. But the advancements in prenatal surgery have been pretty remarkable.
It really makes you appreciate just how far we've come. And speaking of important factors that might not be so obvious, what about nutrition? It seems like such a basic thing, but you've got to figure it plays a huge role in how these kids recover from surgery, right?
Oh, absolutely. I mean, it's easy to overlook, right? But after surgery, a child's body goes into overdrive. It's trying to repair those tissues, regain strength, and to do that, it needs the right fuel.
Right. So it's more than just making sure they're getting enough calories. It's about making sure those calories count, right?
Exactly. We're talking about making sure they're getting enough protein, which is crucial for healing. And then there's certain vitamins and minerals that can actually help reduce inflammation, boost their immune system, that kind of thing.
So the right nutrition can really give these kids an edge when it comes to bouncing back from surgery.
You got it. And again, it goes back to that personalized approach. You know, a pediatric dietitian can work with the family to create a plan that meets that child's specific needs.
There's that teamwork element again. It really seems to be the key. We've talked a lot about the incredible things surgeons can do in the OR, but what about the flip side? What are some of the biggest challenges they face in this field?
Well, one of the biggest challenges is something we touched on earlier: growth. You know, a child's body is constantly changing, and that can make things really tricky.
Right, because you're not just operating on them as they are now. You have to think about how their body's going to change over time.
Exactly. I mean, let's say you're doing a procedure on a child's spine. The surgeon has to consider how much that spine is going to grow and develop in the coming years, and then choose surgical techniques, implants, that can accommodate that growth.
It's like trying to predict the future. How do they even do that?
Well, sometimes they'll use expandable implants that can actually be adjusted as the child grows. That way, you can potentially avoid having to do multiple surgeries down the road.
Wow, that's incredible. It's like they're thinking 10 steps ahead.
They have to, because it's not just about fixing the immediate problem. It's about doing it in a way that minimizes potential complications down the line. And speaking of the future, another big challenge is simply keeping pace with all the technological advancements.
Yeah, I can imagine. Things are changing so fast these days. It's got to be tough to stay ahead of the curve.
It's definitely a constant learning process. But that's part of what makes it so exciting. I mean, new imaging techniques, surgical tools, even artificial intelligence, all of these things are emerging, and they have the potential to make surgery even safer and more effective for these kids.
It's both exciting and a little bit overwhelming when you really start to think about all the possibilities.
It is. But at the end of the day, it always comes back to that same core principle. You know, using these advancements to provide the best possible care for each child.
It really puts things in perspective, doesn't it?
It does.
We've been talking about all these cutting-edge advancements, but I can't help but wonder, what was it like back in the early days of pediatric surgery? You know, before we had all this incredible technology.
Well, it was a whole different ballgame, that's for sure. I mean, imagine a time before we had ventilators, sophisticated monitoring equipment.
Right.
Even something as routine as a blood transfusion. That was a risky proposition back then.
It's mind-blowing when you think about the challenges those early surgeons faced.
Oh, yeah. They were true pioneers. Driven by this incredible compassion for these kids and this belief that surgery, even with the limited tools they had, could actually make a difference.
Are there any names that stand out, you know, real trailblazers in those early days?
Well, one name that always comes up is Dr. William Ladd.
Okay.
He's often called the father of modern pediatric surgery.
Wow.
And this was back in the early 20th century. He did some groundbreaking work on neonatal surgery, like esophageal atresia, for example.
So for those of us who aren't doctors, what is that exactly?
So esophageal atresia, it's a condition where the esophagus, the tube that connects the mouth to the stomach, it doesn't develop properly.
Oh, wow. Okay.
So back then, I mean, surgeons just didn't have the instruments, the techniques, even the understanding of infant physiology to really tackle those kinds of cases. It was considered practically impossible.
So how did this Dr. Ladd, how did he change things?
Well, through a ton of research, a lot of dedication, He wasn't afraid to challenge the conventional wisdom. He came up with these new surgical approaches,
Yeah.
designed special instruments specifically for these tiny patients, and it really paved the way for countless children to survive and thrive.
That's amazing. Just the bravery of these individuals, the willingness to innovate.
Totally.
And on that note, what about the future? What are you most excited about when you think about the future of pediatric surgery?
Well, one area that I think is really fascinating is the intersection of genetics and surgery.
Oh, interesting. Genetics and surgery. Okay. Tell me more.
So we're already starting to see the potential of using genetic testing
Okay.
to identify kids who might be at risk for certain conditions that could require surgery later on.
Oh, wow. So you can kind of get ahead of it.
Exactly. And potentially even intervene early, sometimes even before symptoms develop.
Wow. That's incredible. So it's not even just about treating the problem. It's about understanding the root cause, maybe even preventing it in some cases.
That's the idea. And it gets even wilder. Researchers are looking into gene editing, like actually using these techniques to correct the genetic defects that lead to these conditions in the first place.
Whoa. Okay. So are we talking designer babies here or?
Well, not quite. But we are entering this era where we might be able to actually address these issues at the source, the genome. It's definitely a powerful concept, raises all sorts of ethical questions, but it's incredibly exciting too.
It is. It's both. It's exciting and a little bit whoa, where is this all going? But at the end of the day, it sounds like it all comes back to that same drive to help kids, right?
Yeah.
To alleviate suffering, give them the best chance at a healthy life.
Exactly. And it's important to remember, as technology keeps advancing, at the heart of it all, it's still about the people, right?
Mm-hmm.
The skill of the surgeons, the compassion of the nurses, the dedication of the researchers, all of that is essential.
Well said. Well, as we wrap up this deep dive, I'm just left with this incredible sense of awe at the work that's being done in this field. It's really inspiring.
It is. It's a privilege to be a part of it, for sure.
Well, thank you so much for taking us on this journey. It's been a fascinating deep dive.
My pleasure.